Hi everyone, I am Dr. Davina Nader, Senior Consultant at Rosewalk Hospital, and today I am going to speaking on menstrual cups and the myths surrounding them. So, maintenance of perineal hygiene during menstruation is very important to maintain dignity and for optimum health. And one way to maintain this hygiene is to use menstrual cups. Now, what is a menstrual cup? So, menstrual cup is a reusable cup. It is bell-shaped and it is made of silicone or rubber, which is inserted inside the vagina to collect menstrual blood, and it is reusable and it can be changed in 6 to 12 hours. The advantages are that it is eco-friendly, there's a lot of comfort, it is hygienic, it is cost-friendly, there is less odor as compared to using sanitary pads, and it is really one of the modern methods to take care of menstrual hygiene. Now, some myths are that all cups are same for everybody. But no, one size does not fit all because it all depends on the weight, height, age, and the reproductive capacity of every individual. So the menstrual flow can vary with each cycle, but depending on the age, the menstrual cup size also varies. So if somebody is new or less than 18 years, then they can use a small cup. If they are up to 30 years during their reproductive age, then maybe they can use a middle-sized cup. But if somebody has already given a vaginal birth or they are older in age, then they can use a large cup, and especially if the menstrual flow is too much or heavy. The second myth is that it can get lost in the vagina. So no, that is also a myth because it is held tight by the vaginal walls, and also it gets attached to the lip of the cervix. It is fixed there, so it does not get lost. Cannot move inside the uterine cavity. But yes, it may get a little displaced. But if you give it some time, it will come back to its normal position. The third myth is that you cannot do physical activity during periods if you are using a menstrual cup. So what I want to tell you is that unlike tampons or other things, this is not visible at all, and one can use all the activities like swimming and everything. And if the flow is not very heavy, then of course moderate or heavy exercise is also allowed. The fourth is that it is going to interfere with your normal bowel or urinary movement. So I want to tell you, it does not hinder any way in your biological functions because it gets fixed, in the vagina, and it does not interfere. If you're peeing or you're passing a motion, it's not going to come out. Another thing is that one may lose virginity if they use menstrual cup. Now that is also a myth because that's not a biological concept. It is a social construct. Because what is a hymen? It is just a thin sheath, made of fibrous tissue, and it is at the opening of the vagina, and it can get lost or injured even while doing heavy exercise or cycling or horse riding. So let us keep virginity out of it, and it really does not, relate to that. So these were some of the myths, regarding menstrual cups. But in my experience, it is very convenient. It is cost-effective. One doesn't have to change very often. You can just change while going to bed at night. And generally, it can hold up to 12 hours. It can hold up to 20 ml of menstrual blood. But in case you feel that your flow is heavy, then you can change it more often. So that was about menstrual cups. Thank you.